Hello, this is Jeff Richmond with the Business of Aesthetics. Today, I wanted to take some time. We have a lot of our community members asking us about buying equipment and asking us for help to buy new technology through our equipment buying service and just in general asking for advice. So today, I wanted to take some time and talk about buying smart, buying safe. We're going to do this in a series so that we can go through the different steps. But today I want to cover choosing the right procedure for your office and then choosing the right technology. So choosing the right procedure and choosing the right technology. Later, we'll look at negotiation strategy. We'll look at implementation strategy, financial strategy. Do I purchase this outright? Do I finance it? How do I structure that? Do I take advantage of a Section 179, or do I amortize this over many years, or take the full depreciation up front? And we'll explore some of those other issues. But we can't make the wrong technology work well. So we have to pick the right technology to begin with. And that's where we're going to focus today. So choosing procedures. One of the most important things is ask your patients and ask your staff. Let's make sure that even though you're interested and you're passionate, which is a huge step, you being the leader, you being the champion, you making decisions and wanting to do these procedures, because ultimately you're going to be the best referrer to any new procedure you bring in. But also we want to make sure that there's interest. So maybe you're the only one that's interested. So let's gauge by asking staff and patients a short little questionnaire in the reception area, or even if, a trained esthetician or front desk person can, upon check-in or check-out, say, we're looking at this procedure. Would you have any interest? It's a great way to do lead generation pre-purchase as well. So a lot of times you may end up with 10 or 12 people interested in the technology, and then the financial burden of jumping right into it isn't as scary because you have some patients that you already know are there. What's the goal in bringing in new procedures? Is the goal to attract new patients because you want to build the medical side of the practice? Is it, I want to generate new revenue? And of course, the answer is all of the above for most of us. But I think busy practices that have 2 or 3 weeks out for appointments really need to be focused on building more revenue per hour, per room, not necessarily attracting new patients. And I threw this example up that hair removal is still almost half the cosmetic market in terms of laser treatments. The number of laser hair removal treatments is equal to about half of all the treatments done in the aesthetic market, but it's only around 18% of their revenue. What does this say? Really high volume procedure, not the most profitable procedure. So if I'm a new practice in business and I'm looking to attract new patients and bring them in, I want to bring in these types of procedures like hair removal. If I'm an existing practice that's been, in practice for 20 years, and I'm looking at expanding my services, increasing my total revenue intake, I really don't want hair removal. It's going to jam up my rooms, and my rooms are really valuable. But if I have a lot of capacity in my rooms, then taking some of this lower margin treatments may make a lot of sense. So ultimately, what's the goal? Attracting patients or revenue. And to the extent that you're looking to do both, you play out some of those numbers. So criteria for selecting treatments. This is really important. A lot of physicians and physician practices have sales reps come in with new technology and show them what it does. That's really not an effective way long-term to buy equipment. We want to make sure that you're picking equipment that makes sense for your practice. So one of the things I think about right away is scope of practice. If I'm a, ENT, facial plastic, otolaryngologist, I maybe shouldn't be focused on liposuction, abdominal liposuction, because it hasn't been a part of my practice. That's not to say a decade or two later that you expand your practice, expand your offerings. But as I'm selecting um, these new procedures, does it fit into what I'm doing? And will the patient referral base for the rest of my practice come from offering this procedure? So that when the hype of the procedure is gone, I still have a patient that makes sense for the rest of my practice. Who does it in the office? How much time is it going to take? Is this something that I have to do myself, or is this something that I can delegate to other providers in my practice? And do I have those other providers in the practice to be able to handle this new patient offering? Right along those lines, how invasive is this? The more invasive, the typically we see higher level physician or nurse practitioners, advanced practitioners using the more invasive technology. And also with that is how much downtime, how much hand holding, how much post care is necessary. The treatment room, how much treatment time does this take? Is this a 2-hour procedure and I have that much time, and can I charge accordingly? Or is this a 15-minute procedure? This is going to play into my overall return on investment. And again, in the room time is, the most valuable thing that you have in the practice to generate new revenue. So how much of that time is this going to take? And post-care, we alluded to it before, but how much hand holding? Am I going to get the phone calls? And am I willing to do that? Take weekend calls, or do I only want to do certain procedures Mondays and Tuesdays so I don't have weekend call? And these are things to consider when bringing on a new technology. Have a grand plan. So a lot of physicians, I don't think, do this really well. Again, they're reactive with reps coming into the office with new procedures. The grand plan is important so that you don't duplicate devices for overlapping procedures. In many practices, we'll have 3 or 4 different modalities to treat pigmented lesions. But if I'm just getting started, let's say I want to do brown spots now, but I think maybe tattoo removal may be something that I want to do in the future. Well, maybe I'll consider a Q-switch YAG or a picosecond Q-switch pico, or one of the other, an alexandrite, or so many different modalities. But maybe I'll consider something that down the road will be able to help me with tattoo removal. If I'm really seeing a lot of light facial telangiectasia and just erythema and small telangiectasia, then I may buy an IPL now instead, because I can treat both. So having a grand plan and knowing what you want to do will save you from probably buying a couple pieces of technology that are overlapping. And remember, each technology has its core competency as well. So not only do you need to stay focused on your core competency and what excites you and what makes sense for the practice, but the device, you want to buy a device for its primary application, not its secondary application. So make sure that we think about sizzle versus realistic patient outcomes. We want to take the sizzle is exciting, and for a lot of us it's a great strategy to offer new procedures to our existing patient population. New patients to a practice usually don't show up because a device is really popular. Even if you're the number 1 or number 2 in an area, unless people know who you are and they're already coming to you, the treatment doesn't have the credibility that the rep maybe is putting out to you. Secondarily, outcomes are difficult to achieve in the beginning. Protocols aren't always worked out. So if you're a newer practice or you feel like your reputation may be at stake, it isn't a good time to be reactive to the sizzle. So focus on your own core competency, the core competency of the laser system. So let's start thinking of the energy modality. So we thought about, okay, what procedures make sense for me in my practice and what kind of time is this going to take? Now, how do I pick the right technology? Well, if it's a I say don't be a pioneer. If there's maybe 50 or 100 physicians in the country that are pioneers. They've been doing this a long time. They're used to taking on these new modalities. They understand that not all of them will work. They're working with patients to set realistic expectations, understanding that this is in the research and development phase. They're there for us to do this. In most of our practices, we can't go treat 50 people with ineffective treatments and expect those patients to stick with us. So for the rest of us, we want to be second or third. We don't need to be fifth, but we don't need to be first all the times. We can be second, we can be third. Let's stick with proven technology and procedures. How do we know it's proven? Certainly white papers and other clinical studies, peer-reviewed, published studies are a terrific way for us to do that. We want to make sure that selective photothermolysis, we want to make sure that we're picking the right wavelength or the right energy source to do the right job. Are we getting it to the right target? Is this energy source, is the chromophore for this, highly absorbed? We really want to make sure that we're picking the right energy source to do the right job. Too many times we're buying a device for its peripheral ability instead of its primary ability. So something to consider there. References, look local. Calling somebody in Marina Del Rey or Beverly Hills or Park Avenue, if you're not in those areas, may not be a great reference for you. Of course, they're wildly successful. Many of these companies have, um, physicians that are on their advisory boards or are doing incredibly well, but they're also maybe not paying for consumable or they didn't have the upfront cost on the device that you'll have. So their experience is a little more skewed. Look locally, a couple hours away, look in your own area and see what you can find in terms of your peers. Go on FDA.gov, make sure that the technology is approved for your intended use. That doesn't mean that you can't use off-label, but if you're going to be treating skin tissue, even if we have an FDA approval for heating skin tissue, that would be okay. If it's totally irrelevant to what you're trying to do, you may need to take a second look at it. And probably you don't have the proven technology and the papers and studies to back it up if the FDA hasn't given that approval. State regulations, who can operate the technology, make sure that you're not delegating, say, a CO2 laser to an esthetician that the state or an RN that the state has legislation that says they're not allowed to use. So just check in with your state laws. And then lastly, your medical liability insurance provider. This is a great place to go. They're going to cover you. So send it over to them, what you intend to do. Send a consent form over to them also. Let them look at the consent form. They're the one that's going to defend that consent form for you. So once you get that email back saying, yes, this looks great, go ahead and file that. That's terrific for you to have, knowing that the medical liability insurance provider already looked at the consent form and has understands what you'll be treating with the device and that you're fully covered for that device. Again, thanks for taking the time today. In subsequent sessions, we'll look at negotiation strategy, we'll look at implementation and other key pieces of the equipment purchasing, buying safe and buying smart. If you want to reach out to us at businessofesthetics.org, certainly we can give you more information about our equipment buying service. If you don't want to do all this stuff on your own and you want to be kind of fed the information and have conversations about how to move forward and then have help in getting the acquisition on that equipment, then certainly reach out to us for any of those pieces. We can help with the early on research and then turn it over. Or if you know exactly what you want, you just don't want to handle the reps in the negotiation, we have oversight from the standpoint of kind of being the bee in everyone's garden and can help you with that. So please reach out to us at businessofesthetics.org. Thank you all. Have a terrific day.